If you are one of the fortunate Americans who's managed to avoid the pain of the government shutdown, there's some chance that fortune could be coming to an end very soon. Almost 20 days into the shutdown, millions faced paying dramatically more for health insurance if Congress fails to extend health insurance subsidies. What does that mean? Well, according to the Kaiser Family Foundation analysis, if those tax credits expire, annual out-of-pocket premiums are estimated to increase by 114% next year. That's an average of $1,016. Joining us now at the table, Pennsylvania Congressman Brendan Boyle. He is a ranking member on the House Budget Committee. Congressman Boyle, thanks for coming here. It's so nice to have you with us in person. So my question for you is, even though, as I just said, health insurance premiums will skyrocket for those on the ACA plans, on these marketplace plans, they are a small subset of the population. Why hold the entire government hostage? Why should most Americans care if they are not getting these marketplace plans themselves, let alone getting subsidies?
Well, it's a fair question, but let me just handle any misconception up front. Every American is going to see their health care costs go up. It just so happens that it's the folks who are on the ACA exchanges who are going to see the most damage first. 3 months later, the Medicare cuts take effect.
Medicaid.
January 1st, the Medicare cuts take effect. They're cuts to providers, but of course those cuts and the expenses that will increase will be passed on. Then the Medicaid cuts happen beginning in December of next year because, of course, Republicans on purpose delayed those cuts until a month after the midterm election. And then finally, for the 160 or so million Americans who may get their health care through their employer, they will also see, as studies show, they will see their costs go up as well because of all of the cost shifting that will be happening throughout the system, the closures that we're already seeing announced, especially in rural areas, et cetera. So bottom line, your health care costs are going up because of the Republican tax bill that was passed a few months ago, unless we're successful in delaying or stopping those cuts altogether.
So Senator Katie Britt said that she's open to a discussion on ACA subsidies. Are you seeing any cracks among Republicans in the House? Are any Republicans coming to you privately and saying, hey, this is something that we could potentially work together on and negotiate on?
Yeah, you know, one of the challenges I've had the last 10 months is you'll hear a number of House Republicans or Senate Republicans who will say they're open to X, Y, and Z or sound reasonable. But then when it's time to actually put up the vote, consistently and almost unanimously, they vote a way that's contrary to what they may be signaling. So I think in the end of the day, you have to take people not at their word, but by their voting card.
A lot of them keep repeating this lie that it is illegal immigrants who are going to benefit from all this, and that's who the Democrats are really holding out for, is to make sure that they get free health care. Democrats keep repeating, of course, that that's not true. So, as Elise was just asking about the mindset of your Republican colleagues, do they really believe it when they're saying that to the American public? Well, and how do you put a pin in it once and for all?
Well, I was actually leading part of the floor debate as that final vote that stretched from midnight until well after 8 a.m. Mike Johnson purposely did it in the middle of the night so as few people will be watching as possible. And I kept hearing the same talking point again and again on the other side that, oh, yes, CBO says 15 million Americans will lose their health care, but it's all illegals. It's total BS. As CBO has also cited, none of those folks who will lose their health insurance are here unlawfully. It is, in fact, against the law to qualify for these programs if you're here unlawfully.
What is your understanding of why the Republicans want to do this? I mean, I'm sure you must have conversations with your colleagues and try to get inside their thinking about why it is that they would want to do something that would, as you and other Democrats argue, kick millions of, or drive the insurance costs of millions of Americans through the roof and basically render people uninsurable in this country.
So the basic back of the envelope math is there, what they used to call the big beautiful bill that is now so deeply unpopular, even Donald Trump has attempted to rebrand it. But if you go back to that just a few months ago, remember, there were more than $5 trillion worth of tax cuts, mostly skewed to the top 1%. In order to help pay for that, there were roughly $1.5 trillion worth of cuts. The biggest part of that were the healthcare cuts, about $1 trillion. And then, of course, the rest, the remaining $3.5 trillion, was debt financed. So that is the underlying math why they did this. In the end, tax cuts for the rich is what is driving the healthcare cuts. Now, I do think there are a number of Republicans, especially those in the House, who are maybe in the most competitive dozen or 2 dozen seats. I do think they're aware they have a political problem on their hands, that this is deeply unpopular. So they are a small group of House Republicans who are open, it seems, to some sort of mitigation of the health care cuts. The problem that Mike Johnson runs into, if we ever are going to go back into session, by the way, the problem Mike Johnson will run into is the vast majority of his caucus actually wants these cuts because they don't believe in taxpayer-funded health care to begin with.
Well, the other demand that Democrats have made that hasn't gotten as much attention has to do with something you've been a leader on, which is trying to make it harder for the president to illegally cut funding that has been appropriated by Congress, which by the Constitution has power of the purse. Democrats have been pushing this. I know you have sponsored legislation. What interest is there from your Republican colleagues in either signing on to those conditions that Democrats demand or otherwise trying to reclaim their constitutional duties?
Yeah, so you understand this is an enormous problem that we have right now, that through something called rescissions and impoundment, we have an executive that has essentially seized the power of the purse, maybe the single most important power that Congress has. I've introduced a piece of legislation called the Congressional Power of the Purse Act. All House Budget Committee Democrats are my co-sponsors to attempt to seize that power back for the institution. I will say, as dangerous as it is what the executive is doing right now, Donald Trump and Russ Vought, there are at least some Republicans, such as Steve Womack, a pretty conservative Republican who's on the Appropriations Committee, as well as, I believe, Senator Susan Collins, who have spoken publicly, while many have spoken privately, that they recognize that if we allow this to continue, essentially Congress is completely forfeiting its power to an executive who basically wants to give us the Heisman and have all of the power vested in him. I know that it's very difficult for most of my Republican colleagues to stand up to this president, and so few have been willing to do so. But this is critically important because if this continues to stand, essentially Donald Trump, one person, will be all powerful and will have the end of the system of checks and balances in this country.
Steve Bannon recently made comments basically saying that Congress is already like Russia's equivalent, that all you lawmakers are going in there and it's all for show.
And how, if you were a Republican member of Congress, you're a duly elected person by your constituents.
You should be a little embarrassed by that comment.
You took the word out of my mouth. That how embarrassing that Steve Bannon is calling you irrelevant. And by the way, by extension, Steve Bannon is admitting that they want Donald Trump to have dictatorial power, such as Vladimir Putin has.
Can we go back to the politics of the shutdown, though, writ large? Democrats are slightly better, doing better on the polling of who's getting blamed, but it's now down. I think the last poll I saw was about 6% divide where Republicans are getting more blame, but that's margin of error at this point, and it's gone on a long time. And as Catherine has pointed out earlier, because of the way these enrollment deadlines, a lot of these impacts are going to be felt around the country with certain deadlines to register for your ACA.
Including in Pennsylvania.
In Pennsylvania, too. So what is the incentive politically for Democrats to keep with this fight if you could get some kind of deal to actually deal with subsidies after the budget and in the shutdown?
First, I want to acknowledge up front that for those who are federal workers who are showing up day in and day out and not getting paid, they couldn't care less about the political consequences or sort of the political game aspect of this. So I acknowledge that there is real pain, and that pain may actually increase here in the days and weeks ahead. So I think for all of us, ending this shutdown as soon as possible, but making sure that we hold firm to win a victory for the American people and their health care, that's the ultimate solution here.
Do you think the messaging has to be more than just the healthcare part? Because there are those who are saying, to your point about the impounding and the rescission, that if you ultimately broaden the conversation, broaden the messaging, it is about shutting down Donald Trump's authoritarian agenda, not just for the 20 million people who are going to see their costs go up.
You know, I think there is a challenge in messaging that if you have 5 or 10 messages, you really have 0 message.
Right.
So the idea of making it about one thing that is front and center is important. At the same time, though, that doesn't prevent you from, when working with your colleagues, to recognize there really does need to be a resolution, a firm in-law resolution of this rescissions issue.
Yeah.
Because otherwise, how in the world would I expect you to give me a vote for something tonight, and then, oh, by the way, tomorrow, everything you thought you were getting in that deal.
Which is what happened a couple of months ago when Schumer allowed the resolution. Yeah, and then we saw all these cuts.
Russ Vought is openly saying that's what they plan to do.
Well, so sorry if this is a dumb question, but if it is already unconstitutional for Donald Trump to be doing what he is doing and not spending the funds that Congress has told him to spend, what difference would it make if you pass another law on top of the Constitution that makes it extra illegal?
It's not a stupid question. It's a very good question. First, it is absolutely unconstitutional. The Supreme Court ruled in a 9-0 decision when President Nixon was attempting to do this the very first time. What we have learned, however, and how many times have we learned this, is that Donald Trump, in presenting such a unique threat to our system of governance, has figured out that the Congressional Impoundment Act of 1974 actually does provide insufficient tools in order for Congress to combat when you have an executive who's doing this. So my bill, the Congressional Power of the Purse Act, would essentially give more teeth to the existing law and give us real tools able to ensure the executive can't get away with this.
Very quickly, before we have to go, what was it like to be out as part of the No Kings protest?
It was very inspiring. First, I have to say, as a biased and proud Philadelphian, we have the best backdrop in the country as I'm speaking right in front of Independence Hall.
Oh, yeah.
This beautiful vista overlooking the National Constitution Center in the distance. And what I was struck by, despite all of the rhetoric beforehand from Mike Johnson and Donald Trump calling it a hate America rally, it was like the largest outdoor festival that I've ever been a part of. So it was a fun, joyous atmosphere. And I think that it helped people realize that, oh, wait a minute, I'm not alone. There are others who feel the same way I do. So if anything, it's the sort of thing that can help inspire you further.